pathology, paraneoplastic syndromes. This is a very important PG questions as well as NICT as well as for the professional examinations of second year. Okay, so let's talk about paraneoplastic syndrome. But before this, I want to tell that this is the clinical aspect of neoplasia, and this topic is from neoplasia chapter. And first, I want to start with the general discussion on cachexia. What is cancer cachexia? Cachexia is something that is the it includes patients with advanced and disseminated cancers, terminally have asthenia, that is emaciation, anorexia, prolonged loss of appetite, together referred to as cachexia. Cachexia meaning wasting, So it's a combination of emaciation, that is asthenia, and anorexia, that is loss of appetite. So these together leads to cachexia, that is wasting. Exact mechanism of cachexia is not clear, but it does not occur due to increased nutritional demands of the tumor. So its mechanism is not exactly known, but the short point is it does not occur due to uh, increased nutritional demands of the tumor. Certain cytokines such as tumor necrosis factor alpha, TNF alpha, interleukin 1, and interleukin gamma play a contributory role in cachexia. Various other causes of cancer cachexia include necrosis, ulceration, hemorrhage, infection, malabsorption, and anxiety, pain, insomnia, hypermetabolism, and pyrexia, fever. Okay, so these are the causes of cancer cachexia. Pyrexia is fever of unexplained origin. Fever of unexplained origin is seen, maybe presenting feature in some malignancies such as Hodgkin's disease, adenocarcinoma of kidney, and osteogenic sarcoma, and many other tumors. The exact mechanism of tumor associated fever is not known, but probably the tumor cells themselves elaborate pyrogenes. So, tumor lysis syndrome. This is a condition caused by extensive destruction of a large number of rapidly proliferating tumor cells. This condition is seen more often in cases of lymphomas and leukemias and solid tumors, and may be due to large tumor burden. For example, in Burkitt lymphoma, chemotherapy, administration of glucocorticoids, and some certain hormonal agents. Example, tamoxifen. It is characterized by hyperuricemia, hyperkalemia, hyperphosphatemia, hypocalcemia, all of which result in acidosis and renal failure. Let's talk about paraneoplastic syndrome, which is the main topic today. So, paraneoplastic syndromes is a group of conditions that develop in patients with advanced cancer, which are neither explained by direct and distant spread of tumor, nor by the usual hormone elaboration by the tissue of origin of the tumor. About 10 to 15% of patients with advanced cancer develop one or more of the syndromes included in the PNS, that is paraneoplastic syndrome. Daily PNS may be the earliest manifestation of a latent cancer. The various clinical syndromes included in PNS are summarized in table and are briefly outlined. So the endocrine, hematologic, vascular uh, syndromes, and effects of osseous joints and soft tissues, neuromuscular syndromes, cutaneous syndrome, malabsorption syndrome, renal syndrome, amyloidosis. So paraneoplastic syndromes are a group of conditions in patients who have advanced cancer, and these conditions cannot be explained by direct or distant spread of the tumor, not by the usual hormone elaboration by the tissue of origin of the tumor. About 10 to 15% patients of advanced cancer stage develop one or more syndromes included in this PNS. So PNS is something like suppose if the person is having a tumor of suppose gastric carcinoma, tumor of gastric carcinoma. So they will produce something related to the GIT, okay, but not related to your erythropoiesis or something like that. So in this cases, like in paraneoplastic syndrome, like suppose the Cushing syndrome. Cushing syndrome is something related to the adrenal glands. So if there is tumor of the adrenal gland or there is metastasis of the adrenal gland, then only there can be excessive amount of the hormone. Okay. But if there is no adrenal tumor, then also the Cushing syndrome is occurring. It means that this is a paraneoplastic syndrome. Small cell lung carcinoma, that is carcinoid tumor, islets cell tumor of pancreas, they also produce ACTH or ACTH-like substance that causes Cushing syndrome. So this is something unrelated to the origin of the tumor and the normal organ producing it. This is the PNS, that is paraneoplastic syndrome. So I'll give some examples. So there are endocrine syndromes in which you have hypercalcemia, Cushing syndrome, ectopic ADH, hypoglycemia, ectopic HCG. So summarizing it, that in paraneoplastic syndrome, these are the group of conditions which develop in patients of advanced cancer stage, and this cannot be explained by direct or distant spread of the tumor, nor by the usual hormone of the origin of the tumor, by the tissue of origin of the tumor. Okay, so these are something which are not produced by the uh, uh, actual organ or actual tissues of the tissues. These are produced by some other tumors of different origin. Okay, endocrine syndromes, elaboration of hormones or hormone-like substances by cancer cells of non-endocrine origin is called as ectopic hormone production. Some examples are given. Elaboration of hormone or hormone-like substance by cancer cells of non-endocrine origin is called as ectopic hormone production. Some examples are given below. So elaboration of hormone or hormone-like substance by cancer cells of non-endocrine origin is called as ectopic hormone production. Non-endocrine like origin. Non-endocrine origin is called as ectopic hormone production. Okay. Elaboration of hormone or hormone-like substances by cancer cells of non-endocrine origin is called as ectopic hormone. Ectopic hormone. Ectopic hormone production. Ectopic from some other place, that is non-endocrine origin. So examples are hypercalcemia. Symptomatic hypercalcemia unrelated to hyperparathyroidism. Hypercalcemia is symptomatic hypercalcemia unrelated to hyperparathyroidism. Normally hypercalcemia is due to hyperthyroidism. Hyperparathyroidism produces hypercalcemia. This is called hormonal hypercalcemia of malignancy. Is the most common syndrome in PNS. It occurs from elaboration of parathormone-like substance by tumors such as squamous cell carcinoma of lung, carcinoma kidney, breast, and adult T-cell leukemia, lymphoma. Another cause of humoral hypercalcemia of malignancy is excess production of vitamin D. So did you get this? So these are the elevation of the hormones or hormone-like substances from the non-endocrine origin by cancer cells of the non-endocrine origin. This is called ectopic hormone production. And ectopic hormone production, some examples are hypercalcemia. Hypercalcemia in symptomatic hypercalcemia unrelated to hyperparathyroidism, called humoral hypercalcemia of malignancy. This is the most common syndrome in PNS. It occurs elaboration of parathormone-like substance by tumors such as squamous cell carcinoma of lung. Squamous cell carcinoma of lung is a non-endocrine origin, but still producing the hypercalcemia-like symptoms. Carcinoma kidney, this also produces. Breast also produces. Adult T-cell leukemia or lymphoma, another cause of this. And the cause of this is and another cause of humoral hypercalcemia is the malignancy of excess production of vitamin D. The cause of humoral hypercalcemia of malignancy is excess production of vitamin D. Because of excess production of vitamin D for some of the tumor, it can cause the hypercalcemia, because vitamin D helps in the absorption of the calcium and retaining in our body. It can cause hypercalcemia. excess production of vitamin D. Cushing syndrome, about 10 to 20% patients of Cushing syndrome have ectopic production of ACTH, adrenocorticotropic hormone or adrenocorticotropic like hormone like substance. Most common cause is small cell lung carcinoma. Others are carcinoid tumor and islet cell tumor of pancreas. Ectopic ADH. What is ectopic ADH? Inappropriate. क्या हंसी आ रही? Inappropriate ectopic ADH, inappropriate secretion of vasopressin or ADH may occur in certain tumors such as small cell lung carcinoma and carcinoid tumor. Hypoglycemia, ectopic production of insulin-like growth factor causing hypoglycemia occurs in fibrosarcoma. Hypoglycemia, the ectopic production of insulin-like growth factor 2 causing hypoglycemia occurs in fibrosarcomas, hemangiopericytoma, and hepatocellular carcinoma. Human chorionic gonadotropin HCG, ectopic production of HCG may occur in embryonal carcinoma testis and extragonadal germinomas. So these are the endocrine syndromes. So in endocrine syndrome, you can write about hypercalcemia and excessive vitamin D production from the tumor cells. Okay. So hypercalcemia is produced by squamous cell carcinoma of lung, kidney, breast, adult T cell leukemia, lymphoma, Cushing syndrome, small cell lung carcinoma, carcinoid, and islet tumor of pancreas. Ectopic ADH, that is vasopressin, inappropriate secretion of vasopressin may occur in certain tumors, small cell lung carcinoma, carcinoid tumor, small cell lung carcinoma, carcinoid tumor both Cushing's and ectopic. ACTH and ADH by carcinoid tumor and the small cell lung carcinoma, hypoglycemia by fibrosarcoma, hepatocellular carcinoma, and hemangiopericytoma. Ectopic HCG, embryonal carcinoma, testis, extragonadal germinomas. Okay. These are of the endocrine origin. So this is the elevation or elaboration of the hormone or hormone-like substances by cancer cells of non-endocrine origin. It is called ectopic hormone production. These are hypercalcemia, Cushing syndrome, ectopic ADH, and hypoglycemia and ectopic HCG. So tell me one examples. Hypercalcemia is symptomatic hypercalcemia unrelated to hyperparathyroidism called humoral hypercalcemia of malignancy. Most common syndrome in PNS. It occurs from elaboration of parathormone-like substance by tumors such as squamous cell. The elaboration of parathormone-like substance such as squamous cell carcinoma of lung, carcinoma kidney, carcinoma breast, and adult T cell leukemia, lymphoma. With the cause of humoral hypercalcemia of malignancy, excess production of vitamin D. What is Cushing syndrome? About 10 to 20% of the patients of Cushing syndrome have ectopic production of ACTH or ACTH-like substance. Most common causes small cell lung carcinoma. Others are carcinoid tumor and islet cell tumor of pancreas. Ectopic ADH, that is inappropriate production of ADH or vasopressin, may occur in certain tumors such as small cell lung carcinoma and carcinoid tumor. Hypoglycemia, insulin-like growth factor 2, that is insulin-like growth factor 2 IGF-2 causing hypoglycemia occurs in fibrosarcoma, hemangiopericytoma, and hepatocellular carcinoma. Ectopic HCG is by embryonal carcinoma of testis, and extragonadal germinomas. Extragonadal germinomas. Hematologic syndromes. Frequently, there is a pancytosis. Erythrocytosis, leukocytosis, thrombocytosis, and eosinophilia in many solid tumors and may parallel the course of malignant tumors. Malignant process. Hematologic syndrome, vascular syndrome, osseous joints and soft tissue effects, and neuromuscular syndromes, cutaneous, renal syndromes, malabsorption syndrome, and amyloidosis. Okay, hematologic syndrome, frequently there is pancytosis, erythrocytosis, leukocytosis, thrombocytosis. Cytosis means adequate, excessive. Penia means deficiency, low amounts, right? And eosinophilia in many solid tumors and may parallel the course of malignant process. Erythrocytosis, ectopic patient erythropoietin minus cells stimulate the bone marrow to produce excess of red blood cells and various hematopoietic, example in renal cell carcinoma, hepatocellular carcinoma, and CNS tumors. Hepatocellular carcinoma, CNS tumors. CNS tumors. Hepatocellular carcinoma, CNS tumors. CNS tumors. Hepatocellular carcinoma. Okay, so erythrocytosis is excessive ectopic production of erythropoietin by malignant cells stimulate the bone marrow to produce excess of red blood cells and raise hematocrit. Example in renal cell carcinoma, hepatocellular carcinoma, and CNS tumors. Leukocytosis. Mainly granulocytosis is seen in one-third cases of solid tumors due to secretion of granulocyte colony stimulation factor. Granulocyte colony stimulation factor GCSF. Advanced cases may develop leukemioid reaction. Leukocytosis. Leukocytosis is what? Leukocytosis is mainly granulocytosis seen in one-third cases and of solid tumors due to secretion of granular colony stimulating factor GCSF. Advanced cases may develop leukemioid reaction. What is leukemioid reaction? Find it out and tell me in my next video. Comment it down, guys. We are not commenting anything, so this is your question to write in the comment section, and whoever get it correct, then they'll get a heart and a like from me. Let's see. Renal cell carcinoma, hepatocellular carcinoma, CNS tumor, and leukocytosis is granulocyte colony stimulating factor, and advanced cases leukemioid reaction is present. Okay. Thrombocytosis is due to elaboration of interleukin-6 of thrombopoietin by tumor cells such as lung cancer, cancer of GI tract. So advanced cases may develop leukemioid reaction in leukocytosis, and thrombocytosis is elaboration of interleukin-6 or thrombopoietin by tumor cells. So interleukin-6 is related to the thrombocytosis. Interleukins are very important. Try to make a list of it and try to remember it. Interleukin-6 is important for what? Thrombocytosis. Thrombopoietin by tumor cells. Okay. Have some water. A 2 minutes break. ऐसे में येलो भी था शायद ना, ओए ऐसे में येलो भी था नहीं, कहाँ है, था नहीं था,
हाँ इसका रेस था लेकिन खत्म हो गया।
कौन यूज करे,
नहीं येलो नहीं ब्लू था।
हाँ ब्लू था, कौन यूज करे, मोटा था वो, ज़्यादा थे पेजेस।
इसमें लगे हुआ था दो भी नहीं है क्या है कि कॉलेज है।
जो भी यूज करे मेरे को 50 रुपये देना। Okay, back from break.
कपड़ा ले ले भाई दूध के तो लाई बहुत मजा आई।
Where is my Maggie?
मैं लाती
Give my money back.
बट तब छुड़ाई बनाऊँ।
Interleukin 6 is responsible for thrombocytosis or thrombopoietin. Thrombocytosis, thrombopoietin. Okay. So these are seen in lung cell carcinoma and GI tract. Okay. Let's talk about. So make some remembering notes. 1 minute. Get for summary purpose. So, take a book and scribble so to remember at least something with some summary points that can be asked as questions. So, what is paraneoplastic syndromes? Ectopic एडवांस कैंसर में होता है, not by usual hormone elaboration of the tissue of origin of the tumor. Okay, this is enough. So advanced cancer stage में देखने को मिलता है advanced cancer. This is not direct, not distant spread of tumor. Neither explained by direct or distant spread of tumor, nor by usual hormone elaboration by the tissue of origin of tumor. So these are of how many types? Almost 9 types you can write. These can be asked as short answer for 6 marks according to KNRUHS University. Okay, endocrine system. In endocrine system you have 3/4 is, that is hypercalcemia. Hypercalcemia due to unrelated to hyperparathyroidism. It is called humoral hypercalcemia of malignancy. Most common by squamous cell carcinoma. Write all the examples. Is also due to excess production of vitamin D. And then in that you can also write Cushing syndrome. Cushing syndrome में क्या होता है? Ectopic ACTH production. ACTH production. I'll show my notes at the end of the class. So let's make it fast. Endocrine system में क्या रहता है? Hypercalcemia. And this is the most common cause of PNS. Most common syndromes in PNS. Okay. Paraneoplastic syndromes. Hypercalcemia, it occurs due to unrelated to. It is unrelated to hyperparathyroidism. Hyperparathyroidism. Unrelated to hyperparathyroidism. It is called humoral malignancy, hypercalcemia of malignancy. And another thing is, it occurs from elaboration of parathormone like substance by tumors such as squamous cell carcinoma of lung, excessive production of parathormone like substance by tumors such as squamous cell carcinoma of lung, carcinoma kidney, carcinoma breast, adult T cell leukemia, lymphoma. Not children, adult T cell leukemia, lymphoma. So let's correlate with some other subject like pharmacology. So there is a hypercalcemia. So can you use digoxin in them? Digoxin is given for what? Heart failure. So can you use digoxin in these patients? This is hypercalcemia. The adult T cell leukemia, lymphoma is there. There is a hypercalcemia also in the patient. Malignancy. Another cause of humoral hypercalcemia is excess production of vitamin D. Cushing syndrome में ACTH ज़्यादा होता है. इसमें क्या रहता है? स्मॉल सेल लंग कार्सिनोमा. C means carcinoma and carcinoid tumor. An islet cell tumor of pancreas. What is C? Ectopic ADH. Ectopic ADH. Inappropriate secretion of vasopressin or ADH. Certain tumors such as small cell lung carcinoma and carcinoid tumor. carcinoid tumor. Hypoglycemia. Everything is ectopic. So ectopic production of insulin like growth factor 2. IGF2. So if insulin like growth factor is there, so it will cause hypoglycemia. And these are secreted by what? These are secreted by not small cell. This is not lung. This is fibrosarcoma. Hemangiopericytoma. Hepatocellular. Carcinoma. SCG. Human chorionic gonadotropin. Ectopic HCG, right? Ectopic production. Anterior carcinoma. Testis. Extragonadal germinomas. So I'm going to show my notes after the end of this topic. Another is hematologic syndrome. So this causes pancytosis. And these are solid tumor. Seen? पैनसाइटोसिस 3 चीज़ें, एथ्रोसाइटोसिस, ल्यूकोसाइटोसिस, thrombocytosis. Another is eosinophilia is there. Okay. Erythrocytosis is due to erythropoietin, excessive erythropoietin. Erythropoietin stimulate the bone marrow to produce excessive red blood cells, and there is hematocrit raised. So this is due to renal cell carcinoma, hepatocellular, CNS tumors. Leukocytosis.
सब्जी माँ
granulocyte,
Topical.
action factor, advancement cases में leukemia reaction you have to tell in any of the topic. Thrombocytosis, why it is IL-6, also called thrombopoietin. It is by what? Lung cancer, cancer of GIT, eosinophilia, lymphomas, leukemia due to interleukin 5. Interleukin sin for thrombopoietin, interleukin 5. Eosinophilia. Lymphomas, leukemia, interleukin 5. Advanced cancers में disseminated intravascular coagulation, DIC, advanced cases. Anemia, autoimmune hemolytic anemia, B cell malignancies may develop chronic anemias of chronic disease, normocytic pneumochromic anemia, no battery low. So let's conclude it soon. So anemia is autoimmune hemolytic anemia. It is associated with B cell malignancies. Advanced cancers develop anemia of chronic disease, normocytic pneumochromic anemia. Vascular syndrome, most common thrombotic complications in cases of cancer are development of deep vein thrombosis, DVT. DVT is different and DIC is different. Pulmonary embolism, non-bacterial thrombotic endocarditis, the coexistence of venous thrombosis, thrombophlebitis, visceral cancer, pancreatic and lung cancer, Cross syndrome. Cancer patients' thrombosis is due to various factors: bedridden, immobilized state, obstruction and compression by the tumor. Deep vein thrombosis, pulmonary embolism, non-bacterial thrombotic endocarditis, NBTE, venous thrombosis, thrombophlebitis, visceral cancers, pancreatic and lung cancers. Coexistence of thrombophlebitis, that is venous thrombosis, with visceral cancers, lung cancer, pancreatic cancer, is called Cross syndrome. Predisposition of cancer patients with thrombosis is due to various factors: bedridden, immobilized, obstruction, compression by tumor. It can cause Cross syndrome. Thrombosis, right? Effect on osseous joints and soft tissue: hypertrophic pulmonary osteoarthropathy, clubbing of fingers in case of bronchogenic carcinoma, unknown mechanism but is probably due to increased blood flow to limb. Oncogenic osteomalacia is seen in certain benign mesenchymal tumors. Hypertrophic pulmonary osteoarthropathy, clubbing of fingers, bronchogenic carcinoma, unknown mechanism probably due to increased blood flow to limb. Oncogenic osteomalacia is seen in certain benign mesenchymal tumors. Oncogenic osteomalacia, certain benign mesenchymal tumors. Neuromuscular syndromes. About 5% of cancers are associated with progressive destruction of neurons throughout the nervous system with evidence metastasis in breast cancer. Immunologic mechanism changes of may affect muscle as well. Peripheral neuropathy, cortical cerebellar degeneration, myasthenia gravis syndrome, and polymyositis gravis disease. Changes in neuron affect the muscles as well. In myasthenia gravis, peripheral neuropathy, cortical cerebellar degeneration, myasthenia gravis syndrome, and polymyositis. Cutaneous syndromes, acanthosis nigricans, characterized by appearance of black warty lesions in axilla and in the groin, appear in the course of cancer, stomach, gland, bowel, lung. Other cutaneous lesions in the PNS include seborrheic dermatitis, advanced malignant tumors, and exfoliative dermatitis and lymphomas and Hodgkin's disease. Renal syndromes, renal vein thrombosis or systemic amyloidosis and reduced nephrotic syndrome, patients with cancer. Malabsorption of various dietary components as well as hepatobiliary albuminemia may be associated with a variety of cancers which do not directly involve small bowel. Hypoalbuminemia, variety of cancers which do not directly involve small bowels. Primary amyloid deposits may occur in multiple myeloma, whereas renal cell carcinoma and other solid tumors may be secondary systemic amyloidosis. Okay, this is the thing, and now I'm in table. Is this table visible? So see, this is what hypercalcemia. These are the endocrine syndromes: hypercalcemia, Cushing syndrome, ectopic ADH, hypoglycemia, ectopic HCG. Ectopic HCG is seen in the testicular, that is related to testes, embryonal carcinoma of testes and extragonadal germinomas. Hypercalcemia, lung, squamous cell carcinoma, kidney, breast, adult T cell leukemia, lymphoma. The next is Cushing syndrome. Cushing syndrome, small cell lung carcinoma, carcinoid islets of pancreas. Ectopic ADH, small cell lung carcinoma, carcinoid tumor. Hypoglycemia, insulin like growth factors 2 is there. Fibrosarcoma, hepatocellular carcinoma. Ectopic HCG, embryonal carcinoma, testis, and extragonadal germinomas. It is due to the intact HCG or alpha or beta subunits. Hematological syndromes, erythrocytosis, renal cell carcinoma, hepatocellular carcinoma, CNS tumors, erythropoietin. Erythropoietin. Myelocytosis, leukemioid reaction, solid tumors. Okay. Erythrocytosis, granulocytosis, leukemioid reaction. This is granulocyte colony stimulating factor, granulocyte monocyte colony stimulating factor. Cytosis, cancer, lung, GI tract, interleukin. Which interleukin? 6. 6 for platelets. P, if you reverse this, it will look like P. Okay, 6. Eosinophilia, 5. E is something like 5, is no, S is like 5. DIC, advanced visceral cancers, multiple factors. DIC, normocytic pneumonia, advanced cancers, multiple factors. Anemia, autoimmune. Anemia is due to Thrombocytic dermatomic advanced cancers, autoimmune hemolytic B cell lymphomas, vascular syndrome, deep vein thrombosis, migratory thrombophlebitis, and non-bacterial thrombotic endocarditis. So this is in advanced cancers. Hypercoagulopathy is there. Hypercoagulopathy is there. डीप वेन में क्या होता है? कैंसर ब्रेस्ट, प्रोस्टेट, कोलोरेक्टल, लंग. Hypercoagulopathy, cancer of pancreas and hypercoagulopathy. Osteoarthropathy, clubbing fingers, oncogenic osteomalacia. Peripheral neuropathy, myasthenia gravis, acanthosis nigricans, cancer stomach, seborrheic, dermatitis, exfoliative dermatitis, lymphomas, nephrotic syndromes, advanced cancers, renal vein thrombosis, systemic, okay, malabsorption, amyloidosis, multiple myeloma, cancer of kidney, lymphoma, solid tumors, a protein L. One thing I want to focus is about this one. This one. What is the? It's visible. Thrombophlebitis, NBT. So what is the Troisier syndrome? So vascular, Troisier syndrome is venous thrombosis with visceral cancer. Thrombosis, visceral thrombosis, venous plus visceral thrombosis. तो venous thrombosis is thrombophlebitis. Phlebitis. Visceral cancers, pancreatic, lung. What is Troisier syndrome? Venous plus visceral thrombosis. Venous is also called thrombophlebitis. Visceral cancers are pancreatic and lung cancer. Thank you.